Evening, Dr. Dan, Dr. Ton. I'm Dr. Bello from the Philippines. I've been having a problem with Clear Start. About 20% of my patients complain that they gain weight, although 80% lose weight. 20% feel like they get bloated and they gain, including myself. When I took it for a week, I gained 1 pound a day. And the moment I stopped it, I lost it. So my question is, are there some people who are more sensitive to the fiber? Because I think that's what's causing it. Like I have an actress who was really angry because her stomach really became big. My second question is for the probionics.
Well, let's start with the first question.
Okay, go ahead.
Okay. So with that situation, one of the important things that we need to do in taking Clear Start is hydration. In very rare cases, we have seen what you're describing. It's because people are not hydrating enough. Mm-hmm. So that would be my answer for that.
Is it, what do you call good hydration? Like 10, because I was asking them and they did say and I take about 10 8-ounce glasses a day. They take between 10 and 12. Does it have to be a lot more for people who have this condition?
For that condition, it should be more, yes.
Okay.
Yeah.
And then...
Sorry, before you start, I'm translating to Thai first.
Okay.
Product Clear Start รู้จักใช่ไหมครับใครไม่รู้จักบ้าง Product Clear Start นะครับก็จะมีตัว Life Fiber ใช่ไหมครับแล้วก็มี Unicity แล้วก็จะมีตัว Paraway ใช่ไหมครับก็ถามว่าใช้แล้วเนี่ยปรากฏว่า 80% คนไข้ก็น้ำหนักลดลงแต่ปรากฏว่ามีมา 20% ของคนไข้ที่รู้สึกว่าท้องอืดเกิดจากอะไรคำตอบคือเกิดจากภาวะต้องดื่มน้ำเขาบอกว่าปกติดื่มน้ำมากอยู่แล้วนะบอกว่าถ้าเป็นกรณีก็ให้เพิ่มการดื่มน้ำมากขึ้นกว่าปกติแค่นั้นเองนะครับ Thank you.
Okay. My second question is about probionics. Everybody loves the product. My question is, you're supposed to take 1 sachet a day. If they're on antibiotics and they have a tendency to get candidiasis, so you're destroying a lot of the good and bad bacteria because you're taking antibiotics, can we then increase the dose in that period of time while they're taking? And number 2, is it as effective? Because when I go to the States, they always tell me the probiotics are better when they're refrigerated, etc. And then I'm just wondering what technology did you use to keep supposedly because it's live, but to keep the probiotic bacteria effective?
Yeah, so obviously the lower temperature, the better. Our microencapsulated probiotics, the stability is quite good. But as with any probiotic, they are temperature sensitive. So if you can, keeping them out of the direct sun and in the refrigerator is a good idea.
Mm-hmm. Okay. And then, so can you increase the dose if they're on
antibiotic? And then increasing the dose, taking another would be okay in some cases, but I would stick to the normal use, the recommended use.
Okay. Thank you.
Yep. And now in the future, let's try and do 1 question per person just so that we can expedite this process and make sure everybody has
เวลาเรา
enough
ไม่มากจริง
time.
คืออยากให้ถามแต่คำถามเมื่อกี้เก็ตใช่ไหมครับใครไม่เก็ตบ้างแอนติไบโอติกต้องกินเพิ่มไหมไม่ต้องนะครับอยากให้ซิกมากกว่านะครับแล้วก็แช่ตู้เย็นก็จะดี